Okay, hello everyone. I've got one of our clients here today with me. They've been working with us since September. Um, their name is currently disclosed right now, but we're going to be going back and forth and talking about their progress and a few challenges and variations along the way that have got them here. So I'll be referring to our client as Anonymous, just for privacy purposes. So Anonymous, I was just wondering, the first question here, what were your goals when you started working with us?
Originally, I had an issue with my left knee. Sometime a couple of years previous to engaging with Yushan and Igor, I had an issue where one day basically my knee no longer wanted to support my weight, and I had intense pain on the inside of the joint. So after doing a little bit of rehab with the hospital and trying to identify what the issue was, x-rays were inconclusive. There wasn't really a lot that the physicians were able to tell me. The consensus of opinion was that somehow the meniscus inside the joint may have been damaged or was in some kind of, there was some kind of injury there, but there was no trauma and nothing precipitated that. It just sort of, I guess, just wore out. It slowly got better, but then it just started to bother me again when I stumbled across a subscription that my wife has with Igor Klovanov. Had an article, "Do you have knee pain?" ? And so that piqued my interest, and I said to myself, "Yes, I do." And followed up, was introduced to you, and started to that. So my goal was basically to try and find a way to rehab my knee and make it work the way it's supposed to, reduce the amount of pain, tenderness, and lack of motion and motility on it, with the hopes of then being able to participate more in other kinds of fitness exercises that involved a lot of pressure and jumping up and down and running or walking on the leg and on the knee. So my goal was first get the knee fixed, and then I can advance into other fitness activities.
Okay. All right. So wondering what you've tried in the past to help you reach, the goal to, of course, fix your knee, modify your body composition. So what have you tried in the past?
Well, in the past, I had originally started doing some walking, and then once the knee had decided that it didn't want to cooperate, I did try some rehab exercises with the local hospital. I found them somewhat unsatisfactory. That I was not seeing a lot of improvement, and maybe my expectations were too high. And so I tried to do a little bit of that. I tried to, I had an exercise bike. I tried to use that for a bit, but even that, the flexing of the joint did start to cause some issues with my knee as well. And I was kind of getting stumped. I was running out of options that I myself would be able to come up with. I mean, I don't know that much about how to fix these kinds of things. I thought if that I could just, if I walk on it, walk through it, work with it myself, it would suddenly, I don't know, suddenly, but over time get better. But I found that even though there were improvements with time, I was never back to more than 60 or 70%. It seemed like, I'm able to walk on it, but I wouldn't be able to do a pirouette or any kind of twisting or any kind of sports. Like I couldn't play basketball or any kind of court sport where you have to rely on your leg to change direction. And so those are the things that I did try. I'm not clear on what you mean by body composition. If you could perhaps
Yeah, for sure.
let me know about that.
So you've managed to lose a significant amount of weight over the last few months, and I'll let you talk more about that. The kind of results you've had so far.
Oh, I see.
Yeah,
Okay.
let's talk about that too.
Okay, so one of the other things is like I'm over 50, male, obviously. Well, maybe not obviously if you're going to mask the voice. And I'm looking at it as okay, well, maybe I'm starting to tee up on the back nine now. And as I get older, one of the things that I'm going to want the most would be to be in good health. I'm overweight, so morbidly obese. I have high blood pressure. I have other, I have some, medical issues. My thyroid doesn't play fair, and it doesn't work the way it's supposed to. So I've got some of these conditions, and I just was not finding that, having the knee bother me again is like, okay, that's like the last straw. So I said, well, okay, and maybe part of it is, I weigh too bloody much, and I'm killing my knee. And if I weigh less, maybe that's something I can do to help it heal. So I'm not very good at dieting, but I did sign up for some cognitive behavior training program, trade name Noom, and had started looking at what I was eating, and what I was, how often, and just it's not dieting so much as it's learning new habits and better habits for a healthy lifestyle. Successfully, I'd started that program in January. By February, March, I dropped about 15 to 18 pounds, depending on the fluctuations, which is pretty good. Now it's nowhere near my target, but it is good progress, more than I'd seen probably in 20 years of trying this or trying that, and never sticking with any kind of dietary program. And I'm quite comfortable with the kind of choices that I'm making through this program. That it's things that I'm able to um, just incorporate into my eating lifestyle. So I've been able to do that as a big thing for me, which has been um, it's been quite encouraging. It has motivated me. It has created a positive mental state. It has created uh, a confidence and a pride in what I've been able to accomplish over that time that has continued to allow me to um, push on, especially when you hit your ups and downs and your plateaus and all the other psychological issues that you have to deal with. This program has been very supportive in that fashion. So I found that it's been able to keep me going even when I feel like it's not working the way I want or it doesn't meet my expectations, and it's been a real help, and I feel really good about being able to stick with it, and I'm seeing like maybe not the entire results that I'm hoping for, but I'm certainly moving in the right direction, and I find that extremely encouraging.
For sure. No, that's good to hear. Yeah, Noom is pretty good. It's very similar, like some of the strategies that they use are very similar to the precision nutrition approach that we take. So, of course, using small habits and then building upon that, taking measurements, keeping yourself accountable. So that's pretty good.
Yeah.
So, over the last few months, I know you've had a major diagnosis. Are you willing to talk about how, you've managed to change things, relative to your blood work?
Oh,
Combining
yes.
nutrition and exercise definitely leads to good results. But yeah, sure, let you talk about that.
Sure. So, part of dealing with a problematic thyroid is that I get my blood tested every 6 months or so, just to make sure that the artificial hormones that I take for my thyroid are doing what they're supposed to do and are properly balanced. And of course, like I said before, I'm over 50, so cholesterol and other stuff is being looked at. Um, and I guess maybe not to my surprise, but it certainly wasn't something that I was expecting in January as well. I was diagnosed as type 2 diabetic. So I have type 2 diabetes. My A1C was 10 or 15. It's like some
Yeah,
big number that it's not
10.0.
supposed to be, right? And I'm like, oh, okay. Well, this is like icing on the cake. Now, luckily for me, I had already incorporated sessions with you, and we're doing other things, stretching, and so I was working on an exercise program. So I had been doing that, and I was looking at controlling my diet, was losing weight. So it wasn't that my diabetes was something new that was added to the pile, but it wasn't what was the trigger for me deciding to be a more healthy, individual. But it was something that once I received the diagnosis, I was then able to just continue on. And oddly enough, um, uh, incorporating with the Noom program, um, and with dealing with glycemic index and analysis of food, I was able to, after 3 months of basically just continuing with my sessions and continuing with my already pre-done meal plan, my A1C was back to 5.7, I think, in
Yeah,
the last blood test
5.7.
last week. So, I'm back in the normal range. I've been testing the blood glucose, and I'm figuring out, how it kind of works. It's not quite as linear or as, causal effect as it may be. There's many other variables that impact on it, but I'm starting to get a better sense on how my sugars are working for me personally and what I can and can't do. And so I cut out, in addition to that, once I did get my diabetes diagnosis, I cut out a lot of other things that I might have done under the Noom program, but didn't quite meet under the glycemic index kind of program. So I've I've adapted and I'm balancing the two types of things, where the Noom program deals with caloric density, um, and dealing with the glycemic index kind of thing. So that combination seems to be working. And so that, I think, I've got under. I want to say it's managed. I won't say it's under control, but it is managed, and I think I'm successfully managing it right now. And I think that, based on the feedback I'm getting from the hospital staff, is there's not much more that they can tell me what to do, because I seem to be doing everything that I'm supposed to be doing. So I take that as a win, even though it's, like, I won't say it's a Pyrrhic victory, but it is. Um, I've been dealt that, and I'm dealing with it successfully.
Yeah, no, that's great. I know the last 30 days your fasting glucose was 6.5, or the trend, right? Whereas before it was 8.3 millimoles per
Yes,
liter.
yeah, that's right. So, originally when I'd first been diagnosed, I'm trying to do the finger pricks and all that, the numbers were always in the red. And I'm like, okay, I don't even know what all this means yet. I just know that red is bad, green is good. After continuing with the sessions and, continuing with my diet, which again, I started like virtually like 2 weeks before I got my diagnosis. Um, the numbers were trending downwards. So the 3 month average was, 8.3, but, in the last 2 months, they're down in the sixes, which is, it's it's pre-diabetic, but
Mhm.
it's not like completely the normal range. But even in the last 30 days, it's been sloping down into where it needs to be. And with my A1C at 5.7, as long as I can sort of keep it in that range, then, I think mission accomplished as far as getting it under control. So there's been some very good progress there as well.
Yeah, no, that's awesome. And you've obviously maximized your resources and the professionals available to you. So, that's great. Um, just jumping back to the knee pain. So, given that you've lost, a significant amount of weight since January, and the sensation of how your knee pain was back when we started in September, it's April now. How have things changed for you there?
I've seen some remarkable improvement in, uh, in two or three different avenues. My knee strength, leg strength, just overall, fitness level, strength level in the knee, is much better, due to some focused exercising that we've been doing. Its flexibility is also greater due to the work that we've been doing. Now, again, I'm not going to try and do a ballet pirouette, but I did find, and I coach grade 5, 6, and 7 basketball. So I'm kind of, I'm out on the court a little bit, messing around, and I'm finding that I can actually participate in some of the drills, that do involve sort of moving from side to side, and that without, having my knee buckle in pain, which is what it had been the summer or two before, where I could be walking along and then all of a sudden I wouldn't be able to walk for, like an hour or so as my knee just buckles under me. So I've seen an improvement in the flexibility of it, the strength of it, and I've also seen a reduction in the pain that I do receive. If my knee starts to twinge a little bit or it feels a little sore, that's all it is. It just feels a little sore. It doesn't feel like there's stabbing, sharp knife pains in it where you feel like your bones are grinding away at the grist of your meniscus, to use a colorful image that I hadn't had before. So I don't know if that means that the reduced weight means there's less pressure on the meniscus start to heal, or what it means. But I've seen improvements in a couple of different areas, and even on the exercise bike where my knee is constantly being flexed, it doesn't bother me as much as what it used to, where I could cycle for a couple times and then I would be in quite uncomfortable pain for some time afterwards, and now that is no longer an issue. So, like I say, I've seen improvements in several areas.
Awesome. And I didn't mention this earlier, but we've been working virtually. Of course, it would have been nice to be more hands-on with the approach, and of course, have the assistance of physiotherapists or even a chiropractor at the same time. But given that it's a pandemic, a lot of changes have been going on over the last year, right? We've still been
Yes.
able to work virtually. So yeah, anything you want to add, Anonymous, or I'll call you John Doe?
Fair enough. Yeah, this has been a bit of a new experience for me as well. I mean, we were in, well, I mean, where I am, the pandemic has not been quite as severe as in other parts of Canada. I know that Sinead, you're in Toronto, and that's been a bit of a hotbed. So we've not quite had that kind of thing. But this past year has been a very big introduction to Zoom and virtual teleconferencing. I've always been a fan of it. And just unfortunately, in some remote areas, the technology is there, but the internet infrastructure is not. So I was a little leery when we first started this, but I found that um, I've turned my office into a bit of a mini gym. We've accumulated some more stuff to play with, uh, and the virtual side of it has meant that in the privacy of my own home, without people having to come in and out, and I don't have to be embarrassed about the state of it, I'm able to access full advisory services that I need in order to continue my fitness program, and it's been quite positive from my perspective. I'm able to schedule it when it's convenient for me, when I'm able to do it, and I get instant feedback. It's not hands-on necessarily. You're not like twisting me around, but you're able to see what I'm doing and how I'm doing it as I'm doing it, and that is that is a very very good feature of this whole virtual thing. And you can focus in on what it is. So it's the best we can do in circumstances. I think it works very well, especially for me. And again, like I said, I'm in a remote area where I don't necessarily have the ability to find um, people that have the kind of training or experience to be able to do that. The local hospital, if we don't have necessarily a physiotherapist or something like that on a regular basis, they come through a locum. So sometimes they're here for a while, and sometimes there's nobody. And the only other option is some kind of video referral or conference, or you have to go travel to the next larger town with a larger hospital, and that's not terribly well. It's inconvenient, but it's not practical either. So oddly enough, for me, this is probably the optimal solution for me to access the kind of expertise that I need, from a remote location at a minimal cost. So, I mean, it's not like you guys charge a lot for your sessions, but I mean, like for
Mhm.
me, for the internet.
Yeah,
So I
for
had
sure. Yeah, you don't have
people
to,
there would,
spend money on gas
right,
or, spend the time traveling all the
well,
way to a gym.
right,
Yeah. Actually, you know what? I can't remember. You're what, 800, 1,200 kilometers away? I don't know,
1,200 miles away.
200 miles. Okay, yeah. So quite the distance. Remote area for sure.
Yeah, yeah.
Okay, well,
It's a 3-hour flight by a commercial jet liner.
oh man. Well, anything else you wanted to say?
Um, well, no, lots to say, but what's appropriate, I guess. I am pleased with the support that I've received for the program. Um, I, I certainly enjoy the fact that it is completely fluid and personalized to deal with what I consider to be my issues, and it's a personalized program. It's not just a cookie cutter kind of
Yeah.
approach. I like that. I was I also to uh, to say that working with you, Shane, as well has been quite a pleasure. Again, I've never had to work with a personal trainer or fitness type person. It's more my wife's kind of thing. So I was a little unsure when I started what to expect and what to do, and I found that it's been quite pleasurable. I've enjoyed working with you on a one-to-one basis. You're easy to relate to, and I think um, you're strict but fair, um, which is what I can the best I can hope for. So I think I think I've been pretty lucky to be able to do this and to have a really good coach to help me through it. I may not be the best student all the time, but
That's true. Well, you've
I
been the best
never
student.
feel I never feel like like I'm being shamed or anything. It's just it's just it is a good. I think it is a good dynamic. So my first experience in this kind of remote telehealth kind of stuff has been very positive, and I think this is a model that for a lot of people who live in remote communities like I do, this is something that works. It's not Peloton, but it's um, a little more down to earth, I think.
Yeah, it's pelotoned to your needs. Sorry, cheesy
Yeah,
joke
that's
there.
right. It's
But
that's not
yeah, it comes with the brand. I'm just kidding. But yeah, that's I'm glad you had a great experience, John. Uh, and that really concludes the interview. Just wanted to know if you're okay with me sharing this video to our audiences, clients, and everyone else on social media.
yeah, no, that'd be fine. I don't have any issues with that at all. Um, my obviously not a rehearsed or a scripted kind of response. If I wandered off in some of my answers, sorry, I was just wool gathering and trying to put it all together. But no, by all means. I also don't know how to answer questions simply or shortly. So
Well, that's all good. We want everything to come from the heart, as they say, right? But no,
right
thanks.
on.
Okay. Well,
All
that
right, thanks.
concludes the interview. Thanks. I'm just gonna hit
All right,
stop.
cheers.